Morning guys, so a little video here today for those of you with arthritic knee pain, muscular knee pain. You've got to remember that the quadriceps, I've told you before, need strengthening as they come around the knee capsule and also attach to your hamstring, and similarly the hamstrings at the back of your leg, one attaches to the back of your hip and another head to your knee. So we're going to work on strengthening these bad boys here and hopefully providing ourselves some relief. Listen to your bodies. If you've got any pain, ease off, don't take the movement so far. Remember your Pilates breathing and stuff that I've told you. There's no need to warm up as long as you've been up and running for a few hours before you start these exercises. So they're quite simple, and then I want you to do it in your own time. Reps of 5, 10 or 20, and repeat on the other leg, aiming for that set of 20. So the first exercise we're going to do, you're going to need a chair, and we're going to sit on the edge of the chair so that our sitting bones are supported and our feet are flat on the floor. You can rest your hands on your thighs or on the side of the chair, shoulders back and down. Inhale, and on that exhale, just to bring in a bit of core work, we're going to lower down. Exhale, lift. Inhale, lower. Exhale, lift. Keep the core locked on. Just keep everything else relaxed. So you're strengthening and lengthening here, and you'll be feeling that muscle switch on. 5, 4, 3, 2, and 1. Okay, releasing that leg, and then I'm going to take it to the other side. So again, thinking of posture, ears, shoulders and hips all in line, taking it to the other side. So just lifting, lengthening out. Push through your heel, get as much length in that leg as you can. So inhale and exhale. So doing a sneaky bit of sitting down core work. It's entirely up to you. You can just relax and think of your posture and hold your core locked on, or you can add in your breathing for extra practice for 5. Take this with you and do as many reps as you can, building up to 20 on each side. You might find you can get 20 reps each leg twice a day as you improve, but get your strength better first. Again, if that's too much, lengthen out the leg, take the heel to the floor and bring it back in. So modifications, always modifications, one leg at a time, alternating or repeating on the same leg. If you repeat it, it's more effective because that muscle isn't getting that cheeky rest in between. Okay. The second exercise, so now we've done our quads, is to do our hamstrings. So holding on to the back of the chair should you need support. I'm going to stand sideways so you can see what's happening. So again, Pilates stance, my feet are hip distance apart. Everything's in line, ear, shoulder, hips, knees and ankles. I'm going to start by taking the weight onto the right leg and bending up the left heel. Now again, go to where your edge is. Don't go through any pain. If you can get that squeeze in, try to keep the thighs in line here at the front. So it's that hamstring. So your quads in the front are your extensors, which allow you to straighten your leg. Your hamstrings are your knee flexors as they draw up, bringing that heel towards your bottom. Okay, so that's number 2. The next one involves sitting. Now when we sit, first thing we do, bend our knees. We don't want to do that. So we're going to push back with the bottom. To get this right, you're going to hold a cushion. Think of your posture. Again, 5, 10, 20 reps, bring it, increase it as you go. So we've got the cushion, arms out in front, hug the cushion towards your chest. Inhale, exhale, push through the heels, lift with the hips. Draw the cushion back towards you. As you push back and forward with the cushion, you're using your hips, you're hinging from the hips, taking all that strain off those poor little knees. The way we're built, the hips are far bigger joint, much stronger joint, taking the weight off your knees. So again, don't get yourself dizzy, do 5 and have a rest, maybe get to 10 if you can. And then the last exercise, you can join your staircase. I've just got a little keep fit step here. And this is a lunge. So normally when we lunge, I'll just show you from the side, both knees bend as you go down. By elevating one foot, Put your foot on your step. You're going to elevate, this will be the step of your stairs, elevating this front leg. I'm going to take this leg back a bit. And all we're going to do is we're going to lean forward so that your knee is just tracking towards your toes. Whoops. Lost my balance. It's a good start. So we're just leaning forward, making sure those feet are in tram lines. Leaning forward. So again, strengthening that knee. Keep a soft bend in the back leg, don't overlock it. And then we come to the other side. Put other foot on the step. Get your balance. Make sure your step doesn't slip on the floor if you've got one of these. And we're just leaning forward and back. Forward and back. So by having your foot slightly elevated, you haven't got the same pressure on that knee joint. 5, 4, 3, 2, and 1. And then a last little one for your thighs. We're coming down onto the floor now, kneeling up as I showed you in class. Inhale, leaning back. Exhale. So again, we're working that core now. We're also working your spinal extensors. And working your quads at the front, so you should really feel it starting to burn in the quads. And about one set of 10 reps of this one, once a day to begin with, and then increase it to a second set if you can. Okay, there we have it. Good luck with your knees, and I'll see you in class.